Picture is gone. Good evening, everyone. Welcome to pauseforthetruth.com. I am Jocelyn Turner, your co host for the evening. As always, thank you to those of you who are joining us as our regular guests. If you are new to the show, welcome. We have a lively discussion tonight and look forward to learning so much as usual. Of course, joining me as the co host is Dr. Rogers Kane. How are you doing this evening, Dr. Kane?
I am doing very, 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 very well. I am happy to be here. I'm happy that the listeners have chose to join us again, once again this evening. And you're looking as frozen as ever.
Yeah, for our viewers, we were laughing about me and my retro hairstyle. Dr. Green, who's joining us tonight, said, "Oh, I haven't seen one of those in a long time." Yeah, I know I have the '70s look going, but you know it is what it is. I might be starting a trend. So
He,
welcome,
he,
Dr.
he, he also said Angela Davis will be very proud of you.
Very proud.
Oh, so welcome, Dr. Green, Dr. Trevor Green, as we begin the discussion on Your Heart Matters, how to lower your risk of heart disease. How are you doing, Dr. Green?
Fine, thank you. Very, very well. And I appreciate the opportunity to be here to share. As I have told Dr. Kane, I, I usually do a lot of these pretty much live. Churches, schools, and conferences. But of course, with the with the ongoing, I should say, pandemic, we've gone to new territory, so to speak, and Zoom calls, and we're getting more and more familiar with those. So I'm thanks for the opportunity for having me on, and I hope that I can provide some useful information to viewers and listeners alike.
Yeah, and I'm sure you
Okay,
will,
thank
Dr.
you. I'll hang
And,
up.
and looks like we have our other panelist on, and she is Dr. Judith Rodriguez. How are you doing, Dr. Rodriguez? Welcome.
Thank you. Thank you. I'm doing well. Finally figured out this technology, but I needed a lot of help.
Well, thank you so much for joining the discussion, and I'm so excited. I don't call her Dr. Rodriguez. We're friends, so I call her Judy.
That's
So
right.
Judy and I've had the pleasure of working with her off and on for years, probably over 20 years, on various community projects. Back in the day, Dr. Green, you don't know me. My background is I worked with the Florida Department of Health for over 35 years.
Mhm.
And so I met Dr. Kane probably about 30 years ago, and he doesn't know it, but I consider him a mentor. And so I retired in 2019, but he would not let me just really retire and go somewhere and do nothing. He had all sorts of ideas to keep me busy, and I'm actually grateful for it because, as both of you know, it is important that we stay active, not just physically, but intellectually. So I am happy to impart any information or knowledge that I learned, the many experiences that I had while at the health department, as we really have those conversations about what's happening with people. I know last week we talked about, is HIV still in our community? So Dr. Kane and I talked, what are those other health issues that we were experiencing, people were experiencing prior to the pandemic that didn't go away, right? And the both of you know that. Judy, being a registered dietitian, you know that people are still eating unhealthy. And I promise I'm not talking about myself when I say that. But, and Dr. Green, you also know that heart disease did not go away. So
No,
it
it
is heart. It is Heart Month.
didn't.
Last Friday, a lot of companies encourage their employees to wear red. But I wonder if anybody had the real discussion. Why are we wearing red? What does that really mean? What's the state of heart disease in this country? I know, having worked at the health department, that heart disease and cancer would flip flop as far
Mhm.
as the leading cause of death, not only in this country, in this state, but also in our county. It never wavered, Dr. Green. It
Mhm.
was always between one and two.
And two.
Why is it, do you think, that we have not gotten a grip on controlling heart disease as good as we should have with all the knowledge that's out there.
Yeah, well, that's very intuitive because heart disease will always be with us. But we are what we eat, and I'm not pitching this because we have a dietitian on board. I'm saying it because it's just the truth. Heart disease begins at diet. You literally you are what you eat, and one of the tenets of heart disease is diet. The other one is exercise, and good nutrition long before you get to seeing a guy like myself or Dr. Kane. Those things are very, very important. We are in a very malnourished environment, and I'm sure the dietitian and myself are going to have some very interesting conversations about where diet and what diet plays in heart disease. I am a My style of practicing heart disease actually begins with diet, and it runs me into a lot of trouble because I say things that people don't want to hear. You see, and diet and exercise and diet and cancer go literally go hand in hand.
Yeah, and Judy, I remember when I met Judy years ago, we joked about it, but it really wasn't funny. We compared the similarities between African Americans and Latinas about our diet. We like what we like.
Mhm.
Historically, and I remember sharing I was at someone came to the health department to speak once, and they asked if you had any questions or comments. And quite frankly, my comment was, intellectually, I know when I go to the grocery store what I should buy. However, my upbringing or my heritage trumps intellect. I tend to gravitate towards those foods that I grew up on. And I know, Judy, that I can prepare them differently. I can bake, broil instead of frying, but blah, blah, blah. Who wants that, right? So
Yeah.
tell me, Judy, why is it so hard for people to make those dietary changes when they know they are at risk of having a heart attack or
Yeah.
diabetes or
Yeah. Or high blood pressure,
high
etc.
cholesterol?
Yeah.
Yeah. Mhm.
Well, it's really a combination of things. And in some ways, you kind of have to work with the individual to see how does that combination balance out proportionately for one thing versus the other. Because in some cases, it's really the issue about these are the habits, these are what they've learned to eat from the time they were small. And, habits are ingrained and they're very difficult, very difficult. And so that's one of the things. It's just the good thing about a habit is you don't have to think about it. Every time you have to think, it's taxing on you. And we do so many things. We make so many decisions throughout the day. You don't want to compound that with every time you eat because it's something you do multiple times a day. So that's why, in some ways, it's about trying to help the person learn the healthy habits from the beginning so it just becomes automatic. And oftentimes, that's not what's happening for a variety of reasons, but it started young. The other thing too is what our taste preferences are. And so if you ask somebody to change something about how they eat and it affects the combination of flavors that they like, it's not going to work. And so that from my perspective, a dietitian's perspective, is you want to figure out what are the flavor elements in this person's life that create a satisfying or satiety when they're eating, because it's psychological too. And if you can't give them something that does that, it's not going to happen. Another one is what I call the textural pieces that relate a lot to dieting. Some of us like soft things, soft food. So with them, you can do work on that. Some of us, like me, I like crunchy. And I think culturally, for a lot of Latinos, African Americans, crunchy is really, you want to chew, you get that satisfaction. You put somebody on a liquid diet and they have a preference for crunchy. It's like it's ridiculous. So
Exactly.
what's going to happen? with that. And then the other one I like to mention that we don't really, I think, emphasize enough is that people change, I think, behavior based on three things. And one of them is the cognitive, which is what you're saying. I know what I should be eating. I know it. But that's just knowledge. But then you have to have the other two, which is skills and values. So you know, and in my mind, you almost have to work on values, then skills, then knowledge, because it doesn't matter what people know if it's not what they value. All the amount of intellect in the world isn't going to work. And then they've got to have skills. And that's where I say sometimes as dietitians we fail, because we tell people do this, do that, but we don't teach them how to do it. And so you got to have the values that really say this is important enough that I'm willing to do it. The things that matter to us, we find a way. Okay. But then we got to know how to do it. And
Right.
the knowing it's important. But we tend to only teach the cognitive. We only tell people. So they know it, but they can't do it. It's like one that used to drive me crazy when I worked in community nutrition was a lot of times dietitians would say, oh, you need to bake more. Well, some cultures don't bake. When you tell them to go home and make blueberry muffins, you know, they may buy their baked products, but they'll go home and they'll fry. So now you got to teach them how do you make things in a way that's crunchy, that has that breading, that has all the flavorings you like, but isn't fried. Or how can you help them create a value system where they'll do it, but not every day?
Not every day.
You know, what you guys, let me reflect back on something that was said a little earlier when we talked about the pandemic in terms of how bad, you know, before the pandemic, how bad we were eating in terms of the things that we were eating. A lot of times it was because people, when you were at work, you had to get fast foods because it was convenience and so on and so on. But it looked like when the pandemic came in, not only did it pull the covers back on how bad we were eating, it also caused us to eat worse. And is what I'm hearing and what I've seen, even in my household, you know, where people were doing more ordering out because they were bringing it in, and it wound up giving, you know, giving a head start or a further jump into what Dr. Green mentioned, the leading cause of death, which is cardiovascular disease. And so with that being the case, Dr. Green, tell us, what is cardiovascular disease?
Right. Cardiovascular disease, by definition, is anything that affects the heart and the blood vessels, and the blood vessels around the heart. So, in the specialty that is cardiovascular diseases, we look at what would be plumbing, then all the blood supplies that goes to the heart. We look at the electrical part of it as well. And now we're having an even more interesting conversation about the structural part of cardiovascular diseases, and within that subspecialty of internal medicine, that is cardiovascular diseases, there are also specialties where we call them plumbers, electricians, and now we have carpenters coming along as well. So that's a real world definition and bordering, if you will, of cardiovascular diseases.
I like the analogy in terms of what everyday people can see, because plumbers would be the guys that go in, and I used to call them roto-rooter, when they go in and they open up your heart vessels, you know, from the cholesterol plaque buildup. A lot of blood to flow better. The electricians are those EP guys, you know, the guys that determine the electrical flow around your heart or the lack thereof, you know, with things like AFib, and that a lot of people are, you know, that has really gotten into the forefront of what of heart-related issues. You know, 15 years ago, 10, 15 years ago, atrial fibrillation wasn't as much of an issue as it is now. I think it was there. We just did not look at it. We looked at it different. And then the last thing, when you talked about the carpenters, those are the guys that are now coming in and putting in those anything from an artificial heart
Right.
to artificial valves
Correct.
and so on and so on. Is that what we're gonna? Is that is that appropriate in terms
Yep.
of?
Yep. That's a very good dissertation to get the general public without all the nuances to understand exactly what cardiovascular disease is. So that's excellent. That's what we do.
So why is it that
we just left out the gasoline, the fuel person, because they're the one.
Yes, indeed.
They're
Yes,
bringing in
indeed.
the fuel for all this stuff to work.
Yeah.
So
Yeah.
that is the dietary aspect of it.
That's
So,
the dietary aspect.
But you know, nowadays, when you talk about the pandemic, people are stressed. Some people are working from home now. Dr. Green, are you seeing more people coming into your office, or even you, Dr. Kane, who feel like they might be having some type of heart condition, heart attack, or chest pains, or just feelings that they've not had before that now they're thinking about their cardiovascular health?
Well, let me address the very first part that you mentioned. That the one of the things that the pandemic has inflicted upon us is staying at home, and as we stay at home, given and all the moods that they go, the simple issue that comes up is actually sunlight. We know from that vitamin D is a very important vitamin with respect to not only depression but actually heart disease itself. And there's studies that clearly show that if your vitamin D levels are low, you're prone to cardiovascular disease in general, and also depression. And the reason for that is that the sunlight is a natural path towards your body developing vitamin D in the system. And so it was not unusual for us to know that in countries where we have seasons, seasonal environments, that towards any time after you get past Halloween, all the way through to spring again, that the incidence of depression goes up. And then we saw a concomitant relationship with heart disease as a general term, and we can drill down on that a little bit more. And now it is well recommended, established standard of care that vitamin D should be supplemented at least in the winter months of the year.
Yeah. Dr. Judy, can you get vitamin D from food, or you only?
Yeah,
I know
well, mostly sun, but the dairy beverages are a source, and that goes back to, you're right. If people are home now and they have that opportunity, what are some of the beverages they could drink? And so that would be one of the examples. One of the things we know is that the sugar sweetened beverages are consumed a lot. And if you think historically, for example, a lot of times people, when they sat at the table with their meal, they'd have a glass of milk. In some cases, it was buttermilk, or some variation. Now they sit, they drink a soda. I don't know very many young children, in my family included, which is like drives me crazy, and they know it, that actually sit and drink a glass of milk with their meal. Actually, none of them.
Yeah.
So
that's one of the things, and if people did that 3 times a day versus no times now, right there, a lot of the vitamin D is missed.
That's an easy thing to add. Just tell yourself. But I want to bring something else up, because there's a craze right now. We've been talking about the importance of eating a more plant-based diet. And, when people start saying that, when I told somebody that, they were like, what do you mean? I say, eat things that don't have a mother or a father. After they stopped laughing, then they got it. But anything that's grown from the land. I mean, just getting started. I mean, I always thought, Judy, that you have to have balance, right? I know you need to eat protein. You need to eat, I think about the pyramid, the food groups, and all of that stuff. And looking at my plate, myplate.gov, if people are not familiar with that in terms of how to get started with a healthy eating plan, go on myplate.gov and it'll show you what your plate should look like. And if you take a snapshot of myplate.gov and the plate you had last night for dinner, there's no comparison, right? And I know I've learned that years ago that the amount of meat we should eat should not be larger than the palm of our hand,
Right, right, right. And you
right?
know what? Yeah, and that those are some of the things where I think it's important. You want people to see what are the guidelines, but then you want to figure out how to put it in the construct of what they eat. And so, for example, if it's a lot that the person's used to a lot of meat, one of the ways I think you can approach it is looking at, for example, the pandemic now, where we know that prices have gone up. You you have to remind people, if you're eating 8 to 12 to 10 ounces of meat at a meal and it's costing you $8 to $10 a pound,
Mhm.
you just spent maybe easily 10 to 12 bucks just on the meat piece, which will probably half will turn to fat. So what's one, and that when I did a lot of community work, that's one of the things that I always try to focus on because it was so prevalent in the communities I worked in. One easy way to cut your budget is to cut back on the amount of meat you have. And you can also then focus on the higher quality cuts or more fish. And you can also then easily add fruits and add more vegetables by making more of some of the traditional things like the stews. And a stew is one where you can still have meat, but you can easily cut back the amount and you can easily add more vegetables. And
Yeah.
so that's one way that you can start helping people make the change with the things they already eat in a way that's adding a little bit more of the healthy and taking away a little bit more of the less healthy or the less desirable. Because part of the issue with making the change is that sense of deprivation. And if you tell people, oh, you shouldn't be eating meat, well, you just lost them. But if you say, well, what do you eat? Let's see, how can we make this better? And
Well,
There's a lot. Sorry, Roger. There's a
yeah,
lot to unravel in the last 2 seconds that last 2 minutes of speaking. But and what we want to focus on is to give the audience some things that they can take away that they'll remember. And one of them that just came to mind as we were speaking is that everybody wants to be, depending on where you live, as strong as an ox, or you want to be as strong as a bull. And I always ask the question, what does an ox and a bull eat? They don't eat meat. They eat grasses.
that's
Oh,
right.
wow.
That's
They
right.
eat plants. So the point there is that if you want to be healthy and you want to live as old as Methuselah, and I hope the audience know who Methuselah is, there,
most of us
there, are,
do.
there are three things that you should do. And I of course I defer to the dietitian as well here. One is to get rid of sugar, two, get rid of salt, and three, get rid of meat. And if you can do those three things, you will live to be a ripe old age. Now
Yeah.
that is a hard, hard message to send in this culture that we live in. But there are a lot of good work out there on the internet. A lot of good people. Most of them are nutritionists. A lot of them are cardiologists, sports athletes. A lot of athletes spend a lot of time practicing plant-based, a vegetarian, if you will. And of course, there's all this discussion about what is vegan and what is vegetarian, and I don't want to get into the weeds on that. But in essence, if you can cut back and literally cut out the amount of red meats that you eat, try to shift that over to more fish or fishes, if you will,
Right.
and use a lot and border that with all sorts of the colorful vegetables and plants and base. Something that doesn't have a mother or a father. That's another good one. I like that one. Can I use that?
Sure, I
Yeah,
stole it from somebody else.
there you
Dr.
go.
Green, I have a question to you for you though. I had a friend to tell me they went to the doctor and they had some blood work done, and unfortunately, they don't really understand the difference between HDL, LDL, total cholesterol. Is there an easy way for people to remember that?
Yes,
Well,
there is.
not only, let me just add into
Go ahead.
that. Not only do they not know the difference, they make sure, Dr. Green, that if you can, let us know the benefits and or let us know the benefits or another, the bad part of what it means for each one of those. If you
Yes, indeed. So when you get your cholesterol from the blood, that just gives you a general documentation of what the amount of fats and lipids flowing through your body, cholesterol. And we want that number to be less than 200. For the average person going to the doctor, we want that number to be less than 200. When we drill it down, we look at what is bad cholesterol and, and good cholesterol. The good cholesterol is called the HDL, and because it is an H, we want it to be high. So the higher you can get your HDL, H for high, the better. And the lower you can get your low cholesterol, the LDL, the better. So in terms of numbers, you would want your HDL to be greater than 50, and you want your LDL to be less than 100. Now, notice I didn't use any fancy numbers. I use numbers that people can remember and understand. It's easy to remember 200. It's easy to remember 100. Easy to remember 50. Your doctor, of course, quite rightly so, is going to drill down and get those numbers really tight. But for the general population that we're speaking to here tonight, who I would imagine is very diverse and non-medical, those numbers are easy to remember. Right?
I've
The
never had anybody to break that down to me. The H means we want it high. The
I
L, we want it low.
know.
Yeah.
Yeah,
Hmm.
good, good. And of course, genetics is also a very important thing. The single most important thing that you can do to have a good cholesterol is to choose your parents and choose the ones that have low cholesterol to begin with. But unfortunately, that is a little tricky to do. So you're stuck with who you are. The reason I mention this is because we're three African Americans. We have Hispanic, and each within the African American or within the African diaspora, we will have a trouble getting our HDLs above 50. That's just life. And the only way you can change that is to change your genes. Uh, what is important to know, what is very important to know, is that if you start off as an African American, you have to pay more attention to getting that number down. So you're not going to get that number, that HDL to be above 50 by accident. You gotta work at it. And the way to work at it is getting back again to diet. Is exactly what you have to do. Now let me give you a live example. I walked into the physician's lounge this morning, and it was breakfast, of course. And the first thing that hit me when I opened the door was that beautiful smell of bacon.
Bacon.
yeah.
Oh man, it
Yes.
smelled so
Nothing
good.
like it.
Nothing like bacon. Unfortunately, can't can't live with bacon. Can't do it. If you want your cholesterol to go through the roof instantaneously, bite into bacon. And you'll notice something. If you have 2 or 3 slices of bacon tomorrow morning, and you ate that bacon at the local diner around 8 o'clock, I guarantee you that by 10, 11 o'clock, you're going to feel it. You're going to know it was there if you pay attention to it. You get so used to it that you don't pay attention to it. But if I took one of my patients who loved the bacon off of bacon for about a week, and then I tell them, well, how do you feel around midday? Can you get around the corner? And they say, yeah, I think I'm doing good. I'm feeling good. Yeah. And then you give them that bacon again, they will be able to tell you literally to the time.
Mm.
Yeah, and that is why high-end athletes tend to stay away from salty meats. And the other thing that I'm plugging in here right now that I wanted to get out, which is why I'm taking you down this path, is processed food. And I'm going to defer to the dietitian, and I'm sure she will be more than happy to agree with me that processed foods are a disaster. But they're cheap, they're easy, they're available, and like I said, a cop would never pull you over for eating a donut. He'll pull you over if you're smoking marijuana.
Which caused you to eat the donut.
I walked right into that. I wasn't intending to pick on the cop, but it makes the point. You see?
Yeah.
And
Yeah.
so
What about high blood pressure, though? I know people, I don't know anybody who doesn't suffer from hypertension. Is there a correlation between hypertension and the incidence of heart attacks or strokes?
yes, indeed.
What,
Go ahead.
before you get to that, Trevor, let me just say this. The one thing about that bacon and processed foods, 2 points I like to make. You know, some of the time, sometimes for my patients, their blood pressure been doing great, and all of a sudden they come in one day and it's sky high or high, and I'm going like, the first thing I ask them is, what did you eat the night before?
Mm-hmm.
And undoubtedly, most of the 97% of the time, I can trace it back to a high salt meal the day before, whether it's bacon or baconess, whatever it may be. Processed foods, the same scenario. And when people start talking about smoked meat, they need to remember where smoked meats come from. The term smoked meats. You know, back in the day when particularly there was no refrigeration and you tried to make that pig go as long as you can, or have the whatever meat, venison, or whatever that you killed during the winter, you try to make it last as long as you can. What people would do would take and they once they cut them up, they put it in the smokehouse to keep away the insects and the animals, and then but they roll it up in salt before they put it up in the smokehouse because the salt would help keep the bacteria count down. So we grew a taste for salt, and with fast foods, some of those fast foods are not cooked very well. They don't. If you took the salt out of them, they wouldn't taste very well either. So,
well, that's the whole thing, though. That's important to point out that by definition, a processed food is high in salt because the only way you can preserve it as long as you can is by using salt. And you're right. That's why we need to shift toward fresh fruits and vegetables. You know, if you're going, and the thing too about price, people say, well, it's cheaper. No, it's not. If you think of what a bag of potato chips costs versus a potato and how much potato you're getting in that bag of potato chips, it was not cheaper. It was more.
But Judy is also
the packaging, the salt, the other preservatives that might be in there. When you could have just had the darn potato.
But Judy also, what the part that you left out is what it costs you down the road. When you got to get the cardiac catheterization that Dr. Green
but
he's going to do on you when you need it.
So at the beginning of our conversation, our dietitian Judy, I hope you don't mind me calling you Judy.
No, go ahead.
Okay.
Please do.
You mentioned three things that I literally write down: intellect, skill, and values. Okay. And the what you mentioned here is very interesting. It is easier to go into the convenience store. Let me not use any brand names. At the convenience store and grab a bag of chips and think nothing of it. It's just convenient. It's so easy.
Yes.
Yeah. When I was growing up in the islands, we would not even touch. There were no chips. Your mother got the potato, and she peeled it. If she was more sophisticated, she would not peel it at all. She would actually wash it off, knowing that the skin of the potato is just as probably more nutritional than the meaty than the white meaty part of the potato itself. And they would do it in all sorts of concoctions, as we know. So convenience, and easy access, and the quick things that you can grab and go is the order of the day.
And that's the value you kind of have to work on. And one of
Mhm.
the things I used to tell, because I worked out a lot in immigrant communities, is saying, you came to the United States for a better life.
Mm-hmm. Mm-hmm.
And
Yeah.
so maybe you have prospered financially. Now you
Mhm.
have a home, but your diet has worsened. There's
Mhm.
an irony here.
Yes, here's an irony.
Nothing get better, and then you the one that has a long cost and a
Mhm.
heavy price for you and your offspring has kind of fallen by the wayside. Let's go back
Indeed.
to the values.
As you talk about irony and values, something it just struck me again, and I always tell this story. As a kid growing up in the islands, and I for those of you who don't know, I grew up in Barbados, very very English speaking island in the Caribbean, and if our parents would send us to the grocery store to get stuff, and if you walked into the grocery store and you wanted to pick up a can of sardines, you would say it very quietly. Can I have a can of sardines? Or my mother sent me to pick up some sardines. You don't want to say it too loud, because if you're buying sardines, oh my God, you ought to be, you're at the lowest part of the round. You sardines, oh my God. Come to think of it, and I eat a lot of sardines. You know why? Because sardines is actually far,
Yeah.
far more nutritious than
Yes.
any meat that you can eat. And there's a good
Ooh.
reason. There's a good reason for that now. If I could just dive into it in 2 seconds. Sardines, by virtue of being very small, cannot concentrate all the heavy metals and chemicals in the ocean. So the bigger your fish is, the more likely it is to absorb, concentrate, and remain alive with all the mercury, cadmium, and all the heavy metals on board. Whereas a sardine, small, uh, maybe olive oil, extra virgin olive oil, or just pure water, preferably not salt water, because that will take away the value, is a beautiful thing. The reason I tell that story really is that when we go to Costco's, or we go to I shouldn't say that, or the big box companies, um, you we get we use our value base, and our relative lack of skills to get into the kitchen and do stuff to make our choices, and again, the ease with which we can make these choices uh, informs the kind of diet that we have. So I think that the 3 points that the dietitian mentioned are huge, and should not be underscored at all. Um, when all things get bad, I get work, but I spend a lot of time trying to tell people there's a lot that you can do to prevent you from getting to the cardiologist. Which brings me back to your very first question, Jocelyn. Before we went live. When is a good time to start your visit with the cardiologist, so to speak? You see,
Mhm.
and the answer lies back into something that I mentioned earlier, is how to choose your parents. So you look back at your parents. If your parents have hypertension, high cholesterol, diabetes, not only might it be environmental, but you know that is on and they're overweight, or obese. That is in the drawing board for you. So you have to look in the mirror, and then look at your parents, and then it decides, it is going to inform how you should address, how soon you might actually get to the cardiologist. I know I said a lot, so
No, and that's important. And I want to get back to the question about hypertension, because a lot of people have been diagnosed with high blood pressure, and they don't understand the association with, chronic diseases like hypertension and diabetes and high cholesterol. And even for some folks who have sleep disorders like sleep apnea, the correlation between those things and the potential risk associated with uh, heart disease or stroke. Is there a correlation?
That is to me the cardiologist.
Yes.
Absolutely. Yeah. Sleep is the single most important thing that you can get in your life. Unfortunately, in our Western world, and in developed countries in our first world civilization, we pay very little attention to sleep. That sleep is absolutely so important, and I can do a whole podcast on sleep, and I'm not even a pulmonologist or sleep specialist. Sleep is very important. If you don't get 5 to 6 hours minimum of good night's sleep, your day next day is going to be very problematic, and that will inform your control of your blood pressure. It will also inform the control of your diabetes, and if those two things are out of whack, then cardiovascular disease is right there on the horizon. So sleep is very important. There,
So the topic for today is how to reduce your risk of heart disease. I want to make sure that we really focus on that for the duration of the show so that our viewers and listeners can really have some things to take away. We talked about adding more fruits and vegetables, and there have been a lot of comments, by the way,
Yeah.
about
I,
the cost associated with fruits and vegetables and chicken. I know on the news I saw about chicken. There was also a comment about the use of air fryers. So, can we spend the next few minutes to really talk about ways that people can reduce their risk of developing heart disease? Because the one thing we have not talked about yet is the importance of not smoking and exercise. So, who'd like to start?
well, let me mention something because I did see a comment about the price, and somebody said, well, fruits and vegetables are more expensive. And I think that's another one that goes back to values and more careful analyses. Because if you think about it, fruits and vegetables may seem like they're more expensive than meat, but in actuality, they're not when you compare them on a per pound. Now, the issue there is that people are used to that, or used to buying fried. But keep in mind the health balance is having something like fast food, which was what was mentioned, versus fruits and vegetables. Calorie wise, there's a tremendous difference. So that'll help from the perspective of weight gain, which is one of those mitigating factors for heart disease. The other thing too is the long term, which you had mentioned before too, about the cost. So you may be paying $2 or $3 less now, but if you're going to have to pay for a heart in reference to a heart attack in 5, 10, 15 years, that wasn't cheaper.
Right.
So that's another thing to keep
Pay me
in
now
mind.
or pay me later.
Yeah,
Yeah,
medications that
yeah.
you have to take. Yeah.
And you can, going back to, you can have the beans and the vegetables, and they will provide you as much protein in a good combination, and it will be much less. Generally, when I find that people tell me that it's costing them more, we need to go back and reevaluate, because it means something about the way they're purchasing is not efficient. Because if you think about vegetarians in general, vegetarians are thinner, they're healthier, and their food bill is a lot less.
And plus, nowadays, there's a lot of push to encourage people to grow their own.
Mhm.
And if you don't know how to grow your own garden, check with your local extension office. They will talk to you or teach you, or at least point you in the right direction of how to grow your own garden. And also do it as a community. Maybe you say, I'll grow collards, and your neighbors say, I'll grow the tomatoes, and another neighbor grows cucumbers. And you all come together, bring those things together, and have a bountiful amount of stuff. I know when my friend lived in Africa, she talked about the big difference for her moving to Africa. This was in the early 90s. She talked about how she didn't go to a grocery store where she can get everything. She went to the vegetable market and different markets and bought different parts of the meal. So just think about it though, if we all had a community garden within our community and each neighbor grew something different, and then you get together and it's like a co-op of food. But we haven't talked, Dr. Green, about smoking, or Dr. Kane even. How do you counsel people who they've smoked all of their lives and now they've had a heart attack or threatening some situation, and now have to make those changes about, like, stop smoking and exercising even?
Well, let me give a lead into what Dr. Green will need to kind of expand on. A couple of things, just real quick. The whole thing about the fruits and vegetables. The other thing we have to remember is that our communities, Black and brown, there are a few food deserts in that community. Yes. And having access to the proper nutrition is very difficult, even when people want to have access to it. Let's also remember how some of these grocery stores, especially in our community, I won't name the particular company, but there are places up on Norwood and downtown where when you walk, and even Old in Arlington, where you walk into the door of this grocery store, and what's put up front is all the junk food and all the really bad nutritional items that they're trying to, that people pay extra monies to be able to put that in your face type marketing. Mm-hmm. And if you didn't go in there to buy a bag of potato chips, you look over there and see your vinegar and salt potato chips and go like, okay, this is cheap. I think I'll go ahead and get it, and so on and so on. Now, when it comes down to cardiology, and I use them every day without hesitancy. Where my difficult part comes in, when they're 65 and older, it's not that hard to convince them that they're having cardiac issues, okay? That they may be having cardiac issues. Mm-hmm. When it's the younger guys, these less than 50s, that just feel that, I don't know, they think maybe they got some sense of omnipotence, mm-hmm. and that is not them. And they start having that backache that comes with certain exercise or even sex, be quite frank with you, because they don't want to hear about, sex and having heart-related issues. Also, when it comes down to the trying to restrict them, and I'm going very broad because we got a short amount of time left, very broad, restrict, especially men, when it comes down to restrict them from being able to use the Viagras of the world because they may have some cardiac-related issues, and so on and so on. So, Dr. Green, I guess I was trying to get into that to ask, when you see these younger patients that I may send over, I say younger patients, and that is because I'm suspicioning that they may have some cardiac-related issues. What is some of the first things you may want to do in terms of talking, discussing, working up these patients? I know I probably undid an EKG or chest X-ray, but beyond that, what's...
Well, one of the first things I do with patients like that is to get into, again, the diet. Mm-hmm. I know that sounds pretty corny coming from a sophisticated cardiologist, but I do it every day. And I get into major fights because what you put in is going to influence how your body is going to respond to it. So that is one of my big things. And as you said, and quite rightly so, the younger the patients are, the more they think they're resilient to anything that can go wrong. And by the time you get to 65, your problems were starting at 25. It is not unusual. It's not unusual for me to see young patients with high blood pressure, and or with heart rhythms, Yeah, well, doc, I just get this extra beat, and I get into some serious trouble with patients because I ask a very, very, very powerful question. How much coffee did you have today? And it unusual, I mean, 2, 3 cups of coffee a day, and you come to the cardiologist and you have heart palpitations, and I do all sorts of fancy stuff, and you want me to take you into the lab and do my fancy stuff, and I say, no, 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 no. I know your doctor sent you here for an ablation, which is a procedure that I do. It's a beautiful procedure. It saves lives. Don't get me wrong. But if you're drinking 3 and 4 cups of coffee a day and you're spiking it with iced tea and you throw it back a 5 hour, and you come to me with palpitations, and I tell you I'm going to take you into the lab and do a procedure that's almost criminal.
Right.
But it's
Don't forget, don't forget high blood
what
pressure.
you want me to do. So I get into fights like that. So coffee, very, very important. Smoking, another very important thing, and we need to get out the smoking part. The I happen to have a lot of friends who own gas stations, convenience stores, and I always got very excited about gas. You must be making money if you own a gas station. Well, come to think of it, if you own a gas station, you don't make no money on gas. When you go into a gas station and you go into the convenience store, you just stop there and you see the lotto on one side, and there's a whole fleet of different varieties of smokable stuff. And it's gotten even worse now for the kids because the vaping is a very, 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 very nasty habit. And believe me, I'm seeing patients who are actually younger than the 30s or 40s that we were talking about, who are getting into serious heart problems by vaping. But the main point that I want to say is that the profit is made in a convenience store, right at the cashier, reaching back and giving you a tobacco product. Okay? So
Right. Don't
nicotine is a big issue. Mhm.
don't let
but
us
I
get
think
beyond what Jocelyn mentioned in terms of high blood pressure. We didn't get into the role that high blood pressure plays with heart disease, whether it's cardiomyopathies or increased congestive heart failure, you name it. So, can you elaborate on that some?
Yeah, I will. But the dietitian wanted to make a point. You were going to say,
Oh, yeah, I guess I just want to say quickly that I think it's really important to know that there are things you can do, and it doesn't have to be drastic, especially when it comes to diet. I worry that people think it has to be drastic. Start with small portions, start with reading the labels for the salt, and start with basically just small changes. I think that's really critical. Maybe pick one thing a month and start working on that. And always think about the legacy you're leaving your children. I think that's one, people need to think about what am I teaching them and how's it going to, I'm going to have a heart attack in 20 years and my child is going to have one maybe in 15 years because I didn't leave a good legacy.
How much salt, how many milligrams of salt should you have a day anyway? Is there a limit?
Vary about 1,500, 2,000, but it's just more important to read those labels and compare. Regular oatmeal is 0.
right?
Oatmeal is about 200. Which one's going to be the better choice?
Yeah.
Read the label.
And all due respect to the dietitian, of course, the answer to that question is 0.
Yeah.
Especially if you're African American.
Mean added salt, 0 added salt to
0
Added
salt.
Well, then I'm gonna need a chef, Dr. Green, to tell me how to make my foods flavorful. If you're telling me I can't put any salt in it.
Yeah, I know. It is very difficult. It is very difficult. But I'll point you to 2 places: a Mediterranean diet, Mediterranean foods, and actually Indian food. If you get into Indian food, you'll notice that Indian foods are not salty. They're very spicy.
Yeah.
And you just that you acquire a taste for salt, you can acquire a taste for Mediterranean and Indian food. And this is personal because knowing that I have myself high blood pressure and I want to control it, I try to get down my salt intake as best as I possibly can. And so I know personally it is not it's not an easy thing to do, but it's a choice that you have to make. And maybe and a guy like me, I have no excuse. I can't claim ignorance. So I can't say I didn't know. You know what I'm saying? Or I can. So that's why it pains me when I walk in and I smell that bacon, but I know I can't touch it.
Can't have it. So let's quickly talk about high blood pressure. What's good now? Is it still 120 over 80 or is it 130 over 90 now when you look at the systolic versus the diastolic?
Yeah, that's very important. So to cut a long story short, the number right now is 130 over 80. So 130 at the top, 80 at the bottom. Over the last 10 to 15 years, there was something called the GNC, the National Commission for Hypertension, and they came up with the numbers, all that kind of good stuff. If your blood pressure gets to be above 130 over 80, that's the time to start paying attention, beginning with the diet. When I see a patient in the office with a high blood pressure, I take the blood pressure, I pat them on the shoulder, and I send them home with a piece of paper. And I say, I want you to write down your blood pressures in the morning, whatever time you feel like. And I want you to write them down in the afternoon, whatever time you feel like. This is a practical thing. Why? Because the blood pressure in the office is really not a blood pressure that you should use to make a decision. The doctor is running late. You have 15 minutes you're sitting waiting a half an hour to see him. You come up to the young lady at the desk and she irks you because she wasn't nice to you. By the time you get into my office, your blood pressure is 150 over 90. It ought to be. And I don't have 20 minutes to sit you down to let your blood pressure come back down so that I make a decision on it. So I don't make a decision on blood pressures. And we take a blood pressure, yes, we do. And I tell patients that I don't use that blood pressure. I use what we call ambulatory blood pressure, the blood pressure that you're going to be having in your particular environment doing what you normally do. And then once the patient comes back within the 2 weeks or so with a little profile, and it takes time, of course. Of course, if a patient comes in with blood pressure of 190 over 100, clearly you have to treat that. But we're talking about the 130s and the 140s and the 150s, and you get a sense that you're rushed, the patient is rushed, they're mad with you because you're late, and blood pressure is gone. Forget that. That's a normal response. So that said, once that blood pressure is hovering in the 140s, 150s, or whatever, the first thing is you go back to again diet. Okay, what is that person's diet like? What is their salt intake? How do they eat? Do they eat at 9 o'clock at night, go to bed, and have a bad night's sleep? Wake up in the morning, your blood pressure through the roof. Yeah, I can fix all of that by giving a band-aid, which is the medicines that we prescribe, but that is not solving the problem. That's just a band-aid, and patients expect you to give them a band-aid. They're coming for medicines. They're not coming for a lecture on diet. Yeah, they're not gonna like you. They're gonna say to me, I'm gonna go back to Dr. King, Roger King, and I'm gonna tell him that you're not treating my blood pressure. And he's going to send them back to me, and he's going to say, "You better go back and listen to Dr. Green because he doesn't want to gaff you," because that's what's going to happen. You see?
One thing, Dr. Green, we haven't talked about as we are at the end of our show, we did not talk about at the beginning. How do people know what are the signs of having a heart attack or stroke?
Yes, the signs of let's do a heart attack first. The signs of a heart attack will vary depending on whether you're a man or whether you're a woman. And that brings us a whole other genre that we do not pay attention to heart disease in women. And I am actually trying my level best to get a woman cardiologist in our practice because I think that's very, very important. Let's deal with men first. The quickest way to remember is Sanford and Son. Elizabeth, I'm coming. You have your chest pain and you're coming up to Elizabeth. All right, that's pain. So men get pain, regular pain, and they get their heart attack. Women don't. The signs of a heart attack in the female population is not sleeping well, tired, insomnia, again, another way of saying not eating well, weight gain, just don't have any spunk, a little bit of non-specific tightness in the chest. You can't quite put your finger on it. Those combination of things in a woman in particular will lead you to look to assess whether the patient is having a heart attack or not. Now, in terms of strokes, strokes are pretty ecumenical. Don't care whether you're a man or a woman. If you get a stroke, you can see it. The cleaning lady can tell you that you have a stroke. You see, and most strokes are really due to high blood pressure. The majority of them, particularly in the African American population. There are other reasons to get strokes. You can have a bleed in the brain, not as common as the hypertension, which hardens the artery, not allowing that artery to dilate as well as it can in the brain, and that's what leads to strokes. The other form of a stroke would be a little embolus. This is a little blood clot in the heart that develops if the heart rhythm gets irregular, and we call it atrial fibrillation. Heartbeat should be nice and regular. Fibrillation is when the heart quivers like a bag of worms, and the blood is not flowing properly. Can develop little clots, and that give you a special kind of a stroke. But blood pressure is also a very significant part of hypertension. High blood pressure uh, will lead you into a stroke.
And I always thank you for that explanation. I always like to remind people the importance of taking CPR, because if anyone in their household or in their surroundings in general are having some type of episode, that they will know how to perform CPR, and hands only CPR is an option, so that people who may be concerned, obviously during a pandemic, about mouth to mouth resuscitation, they have to know that hands only chest compressions, hands only CPR can potentially save someone's life. So I always like to make sure I encourage people that that is an option for them. And it's something, as we talk about uh, community associations and churches and whatever, what value they can add to their membership is bringing in someone, and you can do it virtually, to
Mhm.
talk about and teach hands only CPR as an option, teach smoking cessation, to
Mhm.
help those individuals who want to quit smoking and just don't know how to quit smoking. Have someone to come in and talk about stress management, get start a walking club, those really simple things, grow a community garden. All of those are ways that we could really help manage our health in so many different areas. Wouldn't you all agree?
Yes, and one of the important things that you mentioned about community is very important. The reason it's important because as human beings, we tend to be social creatures, and coming together in the community allows you to get rid of the vagaries of life. You have a class for spinning. You have you play bridge or you play cards, or provided there's not too much alcohol at the cards, of course. Or you go to bingo. And once a social gathering, and to get the mood, to forget all the a place where you can go and relax and not have that pressure, share jokes, be jovial. If you go through a single day and you haven't laughed once or twice, you've done yourself a disservice. Learn how to laugh at yourself.
Yeah.
You'll be healthier. Laughing is
Yeah.
literally a very good medicine. And if you can laugh at a lot of stuff, it really saves you on the stress side. You see, the other issue that you raised as well too is the concept of exercise. Exercise, and I know we would need 10 podcasts to cover everything. And I promise that I will come back and do another podcast if you would care to invite me, and I would be happy. But the exercise is also very important. Every single individual should try to get at least 10,000 steps a day.
Yeah. Yeah.
It is very hard. It's
I,
very
I,
hard.
yeah, I like to point out too that social gatherings generally involve food. So one thing to do is to have them and invite everybody to bring a healthier version of a popular and favorite dish.
You
So
know,
that
that,
you're
that,
cooking-
that is so important a point.
Yes.
I when I first came to this country, I went to something called Morning Report and noontime lectures. And in the British world, you wouldn't dare be seen eating during some person's lecture. It just was not. It just didn't happen. And in our environment, and of course, I've when you go to Rome, you do as the Romans do. I fell right into place, and we grab our stuff, and we go into the lecture room, and we eating while the guy. What I'm getting at here is habits. We live. We don't eat to live. We live to eat. Very, very important. If
Yeah,
you
and
eat to
remember
live,
the purpose of the social function is to enjoy each other's company,
yeah,
not the food.
not the food. Well, yeah, again, social. So there's a lot to unpack if you're going to be, and of course, you're a dietitian, not a dietitian, but a vegetarian, and you're really hardcore about and then of course the lady comes and puts something in your plate and something else in your face. It is so hard to be vegetarian. It is very hard because there's so much access to food. I always tell my patients, I'm not gonna bother you about dieting, which of course a dietitian here will of course be very upset with me. I'm not gonna rag you about dieting between Halloween and New
Yeah.
Year's Eve
Yeah,
because it's just
I agree.
it is the worst time of this year to even begin to talk about that. It is a struggle. Now, I capture a lot of imaginations in the first or second week of January. That gives us an opportunity to really dive in because everybody's making their New Year's resolutions, which they probably break by February. But at least it's still an opportunity. So, cultural and social norms to really drill down bears a lot upon how we live. And if we live in communities where we pay a lot of attention to diet and a lot of attention to exercise, we're clearly healthier. I always tell people that if you look at people who become 100 centenarians who live to longer than 100, they have three things in common. Number one, their blood pressures are always low. Number two, they're skinny. You will never find an obese person who lived to be 100. And if you find one of them, call me. I would love to see that person. And number three, that all patients who are more than 100 have at least about 70 to 80% of their original dentition, teeth. Very important. Oral hygiene is also very, very important, and it's very important to see your dentist. We in the medical world have been trying our level best to see the link between oral hygiene and health, and we've not really broken that bug yet. But remember, the one of the dirtiest parts of your body is indeed your mouth if you don't pay attention to hygiene. And to make the point, and Rogers will know this as well. If a person comes into the emergency room with a bite, you have to choose: do you want to treat a dog bite or a human bite? As a physician,
Human.
you're taking the dog bite every time. The human mouth is so filled of bacteria, and that's a very important point to remember. So dentition, to cut it short, dentition is very important together with your diabetes, with your hypertension, and together with your diet, which would inform your level of obesity, your BMI. For back to numbers again, the normal BMI should be less than 25.
Good luck with that.
25.
Good
Right?
luck with that.
And that's body mass index, right, Dr.
Body
Green?
mass index. Correct. Thank you very much for correcting my abbreviation. Very important. Yeah, should we always get caught up with abbreviations? And my brother, who is a very interesting character, beat me up all the time when I do abbreviations. We get so used to them. Yeah, 25. Once you get up to 30, you're getting into mild obesity, And when you get above 30, that's moderate, and above 35, you're grossly obese. So those are very important numbers, 25 and 30. Easy numbers to remember.
So we've gone over a lot tonight, and obviously we can continue this discussion, but
Oh,
I want to do a quick recap of the numbers, because I think the important thing that you heard this evening during the discussion is the importance of knowing your numbers. Dr. Green talked about your total cholesterol being less than 200, your LDL being lower than or greater than 50, sorry, and
Nope,
your
nope,
HD.
nope, nope, nope.
Did I have it backwards?
Yes, your HDL being greater than 50. Remember,
And your
high. You want the high
right.
to be high. And your
Greater than 50,
LDL,
and your wait a minute now, HDL
Hi.
It's a
less
good
than or greater
cholesterol.
than 100.
Mm.
no, HDL. So you want your total cholesterol to be less than 200. You
Right.
want your HDL high, which means you want it greater than 50.
50.
You want your LDL, meaning low density lipoprotein. You want it to be less than 100.
Correct.
Just around, those are round numbers. We
Wait a
can get
minute.
more specific,
I'm
but
sorry,
those are
Dr.
round
Kane. You
numbers.
got to repeat that. HDL, is it HDL less or lower than what?
No,
What's the number?
no. HDL, you want it higher than 50.
H for high. Mhm.
H for high.
I was trying to get the number 50. That's all I was
50.
trying to get.
50.
Higher
Right.
Correct.
than 50, and LDL.
Lower than 100.
Gotcha.
Remember,
So I
lower
had it
in L.
backwards. Right, I had it backwards. So just to repeat, we want the total cholesterol less than 200, LDL less than 100, HDL greater than 50,
Mm.
body mass
Yes.
index or BMI less than 25, your blood pressure less than 130/80. It may
Correct.
seem like a lot, but the important part of the discussion is make sure you have a doctor that you're going to on a regular basis so that you can learn what those numbers mean, get your lab work, take a look at them, have a conversation with your doctor,
Mhm.
keep track of those numbers yourself. Don't just rely on the doctor to do it for you. Know when you have numbers that are high, use the registered dietitian. That's what they went to school for. They can talk to you about all the foods associated with managing all of those things. It's not just about what the scale says, it's about what those very important numbers say in terms of your fat, your cholesterol. And we didn't even talk about your blood sugar tonight. That's another whole
It's
conversation.
a whole good
At
job.
the end of the
Know
show,
your
we
number.
like to give our guests an opportunity to share some final thoughts. And we apologize to our viewers, but hopefully, I'm sure you got a lot from tonight's discussion. We went over an hour, but we like to give our guests an opportunity to give their final thoughts regarding tonight's topic. And so our topic was, of course, how to reduce your risk of heart disease. I'm going to start with you, Judy, and then Dr. Green will go to you. Judy, what are your final thoughts for our viewers?
Uh, um, Really, just three key points. One of them is focus on fresh foods. That's really critical. Read the food labels, especially for the fat content, the sugar content, and the sodium content. Okay. And then start small with things like smaller portions and just smaller amounts of more of the different foods that you like. And so it's difficult, but it can be achieved, and it's worth it for you and for your loved ones.
Thank you. Thank you, Judy. Dr. Green, what about you?
Yes, and my final thoughts would be one, establish a relationship with a good primary care physician. And there are lots of good primary care physicians out there. Uh, Number one. Number two, once you establish that relationship, know your numbers. That was well said by you, Joyce. Know your numbers. Know what the numbers you're supposed to be focusing on, and make sure that you continue to follow up with all your dietary habits. Have a set time for exercise and get good sleep. Those are
Thank
very rudimentary, but they are so very important.
And no
Um,
smoking.
and no smoking. No smoking.
Thank you, Dr. Green. Dr. Kane, what about you? What are your final thoughts?
Well, I'd like to thank our guests for coming on board. There were several things pointed out during our discussion. One listener did comment and said that there are grants out there available for people to help start community gardens, and we're going to look and we'll try to look and find the resources by which to put that on our website so that people can look into reaching out and getting those grants if they're trying to do it for the community. The other thing is, I just wanted to highlight a few points. I want to go back to having a heart attack. There's diverse presentation, as Dr. Green said, diverse presentations and having a heart attack. Classic heart attack being this chest pain on the left side, running up the neck and down the left arm. Classic. But we don't see that often compared to the other ways presented. It can be a backache. It can be heartburn, especially with women. Heartburn, indigestion. That's their favorite thing. I just went and got some Maalox and they got better, and next thing you know, they're in the emergency room having a heart attack. Also, for physicians that may be listening, don't think that women are being hysterical or discount or dismiss their complaints of what's going on, because a lot of emergency room docs tend to ignore women and their complaints about their heart issues. So there's very diverse presentations to that. Be aware of it. Talk to your primary care physician. Talk to your cardiologist. You usually see me before you see Dr. Green. You usually see me before you see Judy. And I try to point you in the right direction, but I definitely point you to those two individuals. The other thing I wanted to get real quick on is vitamin D. And when we're talking about vitamin D, we got to remember that a couple of things. As Dr. Green said, vitamin D, if you got a low vitamin D, you usually may suffer from some level of depression. It's been associated with depression. Mm-hmm. That's why in those months where you do not get much sunlight, your people tend to be more depressed. Well, the other thing we have to keep in mind is that the reason that the sunlight is an issue is because the ultraviolet rays of the sun turn cholecalciferol or cholesterol type chemicals into vitamin D. When there's not as much sunlight, you won't get as much of that metabolism in your skin to vitamin D. And especially in African Americans and Hispanics who are darker skinned, we tend to, what protects us from the damaging effect of ultraviolet rays, skin cancers and stuff, is also detrimental to us getting enough vitamin D. So we need to keep that in mind, that we need more sun or more supplements of vitamin D. If you can't get the sun, because most of us, I walk in my office, the sun hadn't come up. I walk out of the office, the sun is going down. So you got to remember to do that. Take the supplement. You can do 2,000 international units a day, and that should be sufficient. It has been shown that vitamin D, people that are lower in vitamin D tend to do worse with diabetes. I'm not saying it's a cure for it, but they tend to do worse. And they found out that people with low vitamin D and got COVID, that did the worst with COVID, had a very low vitamin D level.
Very important point.
Modulator, meaning it modifies the immune system. And we need to keep that in mind when we start trying to think about vitamin D. And as Judy said, there are many other resources other than taking the pill, even though the pill is easiest. But there are other resources that you can get with milk, buttermilk. A lot of us people are lactose intolerant, so milk may not be an option for us, but that pill is. I know buttermilk is not an option for me. I don't even like the look of buttermilk, so no less taking buttermilk. However, I can't discount the benefits of using buttermilk and what my forefathers did with buttermilk. So with all that, I know I said a mouthful. I just want people to be aware we will need to bring these guests back because all we did was scrape the surface.
Thank you, Dr. Kane.
Can I mention that I would be more than willing to talk about natural products, natural supplements that that our audience should get exposed to in treating not only nutritional on the dietary side, but also making your continue to make your body healthy. And I'll throw out things like coenzyme Q10. Magnesium is one of my favorites.
Yeah.
Very, very, very important. I always tell my patients magnesium is like Rodney Dangerfield, the best electrolyte, but can't get no respect. Very important. Things like niacin, vitamin B12, how to get your vitamin B12, why folate is important, and especially in this time when we're going through COVID, there are things like N-acetylcysteine and selenium and zinc and glutathione. Those are all natural in the body supplements that need to be facilitated to protect your immune health as well, because that also informs a certain level of developing the heart disease, particularly in the COVID arena.
So,
Well,
Dr. Green, I
overall,
started writing them down now. Tell me what I missed. I have magnesium, niacin, vitamin B12, zinc.
Selenium and CoQ10. We can talk about those
Okay.
in
CoQ10,
another podcast.
CoQ10, selenium, magnesium, niacin, vitamin B12,
Mhm.
zinc.
Zinc. And the dietitian will also play a very good, important role in that conversation. If you care to come up, my dear, I would be happy to have that debate with you. I know it sounds strange coming from a cardiologist or even from a physician, because you think that all we do is to give out medicines. Well, my point is that if I can give a person Coumadin, which is literally rat poison, I ought to be telling them about zinc and selenium and glutathione and vitamin B12 and folic acid, all the things that are necessary for healthy living. So I have no
And,
I
difficulty
don't
with it at all.
and in
Very
I
important.
don't
delicious
think the
foods.
conversation between you two will be a debate. I think it'd be more of a both of you guys are thinking alike. I think it's going to be more of a joint conversation on what's healthy for you,
Mhm,
not a debate. Because I don't think she's going to debate what you just said or you
mhm.
debate what she just said. You
Right.
guys are going to agree and
Mhm.
merge on that fact.
And
Well,
one thing that
a lot of the foods we mentioned are high in like the seleniums, the magnesiums, etc. And they're
Right.
great snack foods and things that people.
Correct. Hmm. Hmm. Hmm.
Yeah, which is why I said jokingly, and hopefully people know that I meant well and nothing against those who think otherwise. But if we avoid things that have a mother and a father and
Hmm.
eat more things that come out of the ground, then, or at least that are plant based, then we will do better. And,
Touche.
we talk about meatless Mondays and, really start incorporating those things. Judy talked about the importance of drinking a glass of milk with your meal. We learned a lot. We went over 30 minutes for tonight's show. Of course, as you can see, having a conversation about heart disease and reducing your risk, it can be overwhelming. Hopefully you learn some tips from our guests. They are obviously experts in their field. They gave of themselves their time tonight to share information with you as we focus on Heart Health Month. Next week, we will have another enlightening discussion about a topic that we don't like to talk about, and that is teen dating violence. Unfortunately, it is a topic that affects so many families with children, and they may not be having that tough conversation. As always, make sure you continue to protect yourself from COVID. We are still living within a pandemic. Make sure you get your vaccine. If you don't know where to go to get your vaccine, just simply put in vaccine.gov and put in your zip code and you'll find a location. Or you can call the health department here in Jacksonville. It's 253-1000, or go to the Florida Department of Health website to learn where you can get a vaccine. Make sure that you are eating healthy, managing your stress, getting out exercising, doing those socialization things that we talked about tonight, and we'll do okay. And Dr.
What-
Kane, looks like you just have something burning to say.
I can't let you get away without saying two things. One is that our guests and their anybody's ability to contact them should they want to utilize their services, we're going to post on our website. They're going to provide it to us, and so we'll make sure that if you want to have a conference or a consultation with either of our guests that are willing, that they will be available and access to them will be made available to our viewers at our website. That's one. Two, I can't get off the show without thanking our technological expert and engineer. If you need his help and assistance, you just call Tyrone, and Tyrone.net will be able to provide you with all your technological services and needs. And that's how I say good night.
And lastly, make sure you know what your health insurance plans offer, because your health insurance plan, for instance, may have an option for you to join plans like Silver Sneakers to exercise, or even offer some gym benefits. It also may give you the option to see a registered dietitian as you would your own primary care doctor and or a cardiologist. So know your insurance plan, know your numbers, and know to tune in next Tuesday, 6:30 p.m., pauseforthetruth.com, where we tell you what's really going on. Thank you to our guests, and good evening.
Thank you.
Good night.